Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. One of the questions I get asked the most many times during the year is, what do you think caused my cancer? Now, I've always been of the mindset, why does it even matter? Your focus should be on dealing with your treatment, getting into remission. I worry about, worrying if you're that focused on the why, that it's going to prevent you from moving forward, with your treatment and your care. But I get it. There are several reasons to understand, to want to know why, what causes the cancer. A lot of it can be from understanding if you were discovered to have cancer because of genetics, like several cancers seem to have that kind of link. If it's a lifestyle, and by lifestyle, of course, we're talking about smoking and diet, things like that. Or if it's environmental, which has often been proven to be the case in certain types of cancers. But the truth is, when it comes to an individual diagnosis with cancer, there really isn't a lot of time to focus on the why, because treating cancer is all about time and getting on it right away. We can't stand there and just poke and try to research, trace everything that led up to that point. Another possible reason for wanting to know what causes the cancer is definitely wanting something to blame, someone to blame. Certain cancers do have, known causes or contributors. We know smoking can cause cancer. Uh, Odd story, my father passed away from lung cancer, and I was there with him when he was told the news that he had cancer. My father was a 50-year smoker and actually asked the oncologist, "So, doc, what do you think caused my cancer?" And he did it with a straight face. And I looked over at him and I'm like, "Dad, are you really, really wasting that doctor's time asking that question? You've been smoking for over 50 years." And my dad was like, "Yeah, I know, but I just want to know if there were any other possibilities that it could be." Made a difference to him. But my mother, now, my parents are divorced, were divorced over 45 years at that point. But my mother, to this day, also a smoker, the same amount of time as him, only longer now that she's survived him, had a scan done a year or two ago, and there's no impact from smoking on her lungs or her heart. So it's not guaranteed to impact everybody, but smoking does cause cancer. If you're diagnosed with lung cancer, if you're a smoker, you can pretty much chalk it up to that. It's not guaranteed you're going to get lung cancer, but if you can, that's a direction you can point in. But I've also come across many other lung cancer patients who don't smoke at all. Could there be a history of secondhand smoke? I grew up that way, obviously, back in the 60s and 70s with the windows rolled up and parents just puffing away with the smoke filling up the interior of the car. Um, or maybe not at all. You could have been exposed to asbestos or any other kind of things that could lead to lung cancer. Myself, having gone through radiation therapy for my Hodgkin's lymphoma, which was my first cancer, and I'm saying it that way on purpose, I have nodules on my lungs. Most of them are unidentified yet. In fact, all of them aren't officially identified. There's one that is indicative of cancer. My pulmonologist is quite certain that the most notable nodule that I have on my lung is cancer. I just have not agreed to having it biopsied yet. And that's a different video. Okay? But I'm not a smoker. So, but it can be pointed out to my radiation therapy as a potential cause. So There are other factors that can play a role in this. Skin cancer, you have environmental, the sun, radiation therapy. That's another risk that I have. You can see this little spot right here that gets the attention of my doctors every time I go in to see them. They compare this to pictures that they've taken to make sure that it's not changing its texture, its size, its shape, or anything like that. As far as Hodgkin's go, again, I talk in general terms for the most part, but I can talk specifically about Hodgkin's lymphoma. And there's no known cause for that. But like I said, there are constantly questions. Do you think it could be this? Do you think it could be that? Do you think it could be mold? Do you think it could have been the water? There was a cluster of us that ended up with Hodgkin's lymphoma. There's no known cause because it's not, Hodgkin's lymphoma, unfortunately, is one of the rare cancers. So the fact that they're able to treat it as successfully as they do, there's not a whole lot of research on it, and definitely not a lot of research into the why. Now, I can tell you anecdotally that there is a commonality among Hodgkin's patients, that in our past somewhere, there seems to be a connection between us with the Epstein-Barr virus or mononucleosis. Yes, the kissing disease. Now, I know that prior to my diagnosis at the age of 22, when I was 19, I did come down with mono, which is caused by the Epstein-Barr virus. Now, I have to tell you, I've never been tested for the Epstein-Barr virus, but if you had mono, chances are you had EBV. Now, that does not mean just because you've had the Epstein-Barr virus that you're going to end up getting Hodgkin's lymphoma. There's no proof that that leads to Hodgkin's lymphoma, but it is a common bond between the majority of us Hodgkin's survivors. Now, I urge caution with that for a reason. My daughter was diagnosed with the Epstein-Barr virus. Now, the good thing for her is that she's adopted. So she's not going to inherit anything from me. Hodgkin's lymphoma is not generally genetically passed on to children. But as I said, she had Epstein-Barr virus. And of course, it's my hope that this does not turn into Hodgkin's lymphoma, but she's not going through her life worrying about that she's going to. And here's the number why. Hodgkin's lymphoma is a rare cancer. Probably, I think according to the American Cancer Society, there's maybe 50,000 people that get diagnosed every year. That's not a lot. Okay, compared to the number of people that have Epstein-Barr virus, which is much, much higher. But again, that's just something that pops up as a coincidence. And there are other theories. You see the ads for Roundup lawsuit and stuff like that. And on their website, they list lymphomas. But when you call them and they get specific about the different lymphomas, there's one lymphoma that gets negated from their lawsuit, Hodgkin's lymphoma. Look, worrying about what causes your cancer, I try to explain to people, is like spilling grape juice on a white carpet. Okay, are you going to stand there and just say, "Oh my God, why did this happen? How? What do I do?" No, you're going to clean it up. You're going to act right away before that grape juice has a chance to settle in and do more damage. And I would really strongly suggest that if you are unfortunately diagnosed with cancer, not to concentrate so much on the why or the what. Just get it cleaned up. Get on it, get treated, get into remission, and hopefully, if you are ever diagnosed with cancer, you get to see a long-term remission like I have. I'm in remission 35 years. I'm going to hit year number 36 in March, and hopefully you'll get to see those days as well. Until next time, this is Paul's Heart.